So today I'm going to be talking about the funny bone nerve, also known as the ulnar nerve. Nothing funny about it, but the medical terminology is cubital tunnel syndrome or ulnar nerve entrapment. So some of the causes of cubital tunnel syndrome is if you are putting pressure right in this area here, right inside your elbow for prolonged periods. So if you're doing that for prolonged periods, you're sitting in the office working all the time on a hard surface, that can cause you to have numbing, tingling sensation into your pinky and ring finger. Also, if you're on the phone all the time, flexed arm all the time for prolonged periods, that's going to also cause damage to the nerve and give you symptoms as well. And then the third thing is if you just injure your elbow, where it causes fracture to the bone, or there's bone spurs, or there's a misalignment of the bone or dislocation. All of those can cause you to have the symptoms of cubital tunnel syndrome. So as I mentioned, some of the symptoms are numbing, tingling to the ring finger and the pinky finger. Also, there's weakness in the hand, there's loss of sensation, and there can also be just pain on the muscles on the forearm. So some of the things you don't want to do to keep the symptoms from reoccurring is if you are sitting at a desk that has a chair with a hard armrests, make sure to either use a towel or try to get some cushion so that there's not a lot of compression on that area. And if you're talking on the phone all the time, a headpiece would be very helpful in allowing your arm to rest instead of being in the flexed position. Also, when you're sleeping, try not to get into that flexed position as well. Try to relax your arm and maybe even put a pillow under it just to give it some more cushion. So I'm going to go over 4 things you can do to help kind of relieve some of the symptoms and decrease the pain. Well, the first thing you want to do is just massage the muscles. Massage the muscles along the forearm here. Try not to massage right in this area where the ulnar nerve actually comes through, because that can actually cause your symptoms to increase sometimes. So if you're massaging these muscles, it will help relieve some of that muscle tension. A lot of times when you get the cubital tunnel syndrome, these muscles, they get so tense because the body is just responding to the stimulus here. The second thing you can do is stretch the muscles of the forearm. So what you want to do is point your fingers straight and then bend them back towards you. And then what you can do is grab your fingers and pull until you feel a stretch. Now, if you're feeling increased pain, maybe let off on the stretch a little bit. And you're just going to hold that for 30 seconds. Now, these are stretching the forearm muscles down here. You want to stretch these forearm muscles up here as well. So just bring your fingers down and pull towards you as well. And hold this for 30 seconds. And you want to do this 3 times. Now, the third thing is called nerve flossing. And what this is basically getting the nerve to move through, the muscles, the tunnel, basically that's where it's at, so that it's not as stuck, so there's more movement of the nerve. So how you're going to do this is first you're going to bring the affected arm, your hand towards your ear, as if you're going to talk on the phone here, and then raise your arm as well, and you're just going to bring it down towards your ear like this. And then the second move is you're going to point your fingers downwards and extend your elbow, okay? So you're just going back and forth like this. Now, if you're feeling okay with this, the next step is to, when you bring your hand towards your ear, bring your head as well, and towards your hand, that is. And when you go away, you're going to bring your head away from it. So that's going to really give you more of a stretch of the nerve. So this is the second step. So all you're doing is you're doing that back and forth for 20 times, and you don't have to do this exercise every day. This is just to get some movement in that nerve. Now the last thing I want to show you is kind of a combination of like nerve flossing and also moving using your muscles to help exercise them in a way. So this is kind of like doing a breaststroke when you're swimming. So a breaststroke when you're swimming, you're doing this. But with this exercise, it's very similar. Instead of going in like this, I want you to start out with your hands this way. Now you can do one arm, two arms. I'm going to show you both of my hands so that you can kind of see how it is, or why I call it kind of like a breaststroke. Okay, so you're going to start both of your hands out like this, and then you'll turn it outwards, and then you do like a swimming motion. You don't have to go all the way back. Just come right towards your body again and bring right back up. So you're just doing this for about 20 times as well too. Back and forth here. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.